leadership is very important. Can you amplify your voice when your voice is not heard? Can you amplify your voice when you are being represented in an authority that is called minority, and you don't even have a voice? Even when you are there, what you say does not come to public display. It does not come out. It can be removed or can be brushed aside. So there is need for inclusion in the issue of leadership in nursing workforce, for example. Very important in nursing national, international boards, in nursing association. Leadership is key if we are going to have inclusion of nursing workforce in all of these now. And if you do this, it will help us as African investigators, African researchers to be able to engage in solving health challenges as experts that are domiciled in Africa on the continent, identify with the problem on the continent, proffer on the African specific solution to those problems.
You're listening to Patterns and Meaning, a podcast by Seed Global Health. We find meaning in patterns, connect history to the present, and illuminate the way forward in global health. I am your host, Adam Tokuno. Our guest today is Dr. Prisca Adejumo. Dr. Adejumo is the head of the Department of Nursing at the University of Ibadan and the coordinator of the Pilot Cancer Risk Prevention Clinic at the University College Hospital in Ibadan, Nigeria. She's a professor of nursing, a researcher, and a scholar in the field of oncology nursing. Dr. Adejumo integrated cancer genomics into the nurses' continuing professional development program and undergraduate curriculum at the University of Benin, as well as the open and distance learning modules of the University of Ibadan. She is a fellow of the West African College of Nursing and a Nursing and Midwifery Council certified adult health nurse specialist. Her latest research interest is in genetic counseling, with emphasis on improving cancer patient outcomes and enhancing nurses' competencies in cancer genetics. Welcome to Patterns and Meaning, Dr. Prisca. It's a pleasure to have you today as a guest.
Thank you so much. Good morning, good afternoon, evening, wherever you'll be listening to us. And thank you so much, Adam, for inviting me. And I'm happy to be here. Thank you.
So, Dr. Prisca, one aspect of decolonizing global health that we have touched on this podcast is the common practice of people from the West going to low and middle income countries, spending a few days in the community, getting high-level insights into research that is already being conducted anyway, and then writing journal articles where they are listed as the lead author, and you'll get opportunities to present on that work. So in your experience working in Nigeria and with colleagues across Africa, have you seen this dynamic play out in any way?
Thank you very much for this question. Yes, I have seen, but not personal experience. And from other colleagues where this has been observed and in empirical studies, where I've also had the privilege of really coming across things like this, I find this narrative in quite a number of instances to be true. And the question is, when you look at what is going on in terms of inequalities, you talk about colonialism, you talk about imperialism, and you want to find out when you compare health inequalities between the global north, maybe the high-income countries, because all these nomenclatures just came out of the blues. You know, the high-income countries and the low-income countries. And there are lots of research opportunities that are available in Africa on the continent, and people are interested in this, and they want to come here and then use it as they play football kind of ground, and they're going to catch up with lots of data, and they are going to fly away with them. And then when they get there, there's something about the research process where whatever research process you're embarking upon, whatever research you are embarking upon, there's a process that you follow. And the last phase or stage of that process is dissemination of information. So you want to actually go ahead and disseminate your findings. You want to go to international conference to go and make a presentation. You want to write it maybe in an outlet, in a journal, in a peer review medium, to let the scientific world or community actually know what you have done. And so that last phase becomes very important. And when you want to write, This is where the issue it comes in. And I'm sure we may see come to talk about this later on. When there's that disparity, that inequality between the high income countries and the low income countries, the very important question that we need to ask ourselves is, are these individuals, these investigators, these researchers who are coming from these high income countries, are they really interested in developing our nations? Or are they just interested in the funding opportunities to get something out of this whole scenario that we are engaging ourselves? If you don't have that philosophical underpinning, and then you just go ahead headlong, and then when it's time to actually begin to bring out at that phase of dissemination of information, when you want to write for publication, then there are going to be issues. And these issues, many people do not understand negotiation ab initio. They don't engage in what is in this for me. How are we going to publish this when we get there? What's going to be the arrangement of authorship or of authors? Because there are guidelines in responsible conduct of research. There are guidelines that must be followed when it comes to authorship. So the issue is when you have the interplay, when you have this inequality displayed between investigators from high income countries and low income countries, when it's time to publish, that's where they are going to have issues, which is the very important aspect of the research process, to sell out your idea, to give people your findings, to let the scientific community consume what is it that you have found in that research that you have done. So that's where there's going to be issue. If people are interested in actually making sure that this, our continent as a nation, is developed, this narrative that we are having now is not going to play out. But of course, we all know that there are strings that are attached. I don't think we want to go into that for now.
So then how does this shape the narrative about who is actually considered a global expert and who is not?
May I start from the concept of colonialism? When we are talking about colonialism, we all know very popular thing is the ant colony. You know, when it comes there, if you have a piece of sugar, at the end of the day, that sugar disappears. No matter what the size of the cube of the sugar is, it goes off completely and is taken over. So the concept of colonialism is a concept that brings about something that is very important. When you get to a community, you try to establish control over the indigenous owner, the settlers of that community. And there are phases and processes that also engages in. For example, you have to gain acceptance of the people. You have to claim that you have something that you are bringing for them. And then, of course, when that happens, you establish control. So if you have someone, is an investigator who is coming from high income country, and this is on the other side, who is from low income country, it's like the scale, the balance. It's not balanced in the sense that when you are done with that work and you are going to publish, which was the point I was referring to earlier, who comes first? And if the person who is coming from high income, the investigator from high income country, has his or her name on the first list, because most of the times when the ideas and the investigation is concluded, research is taken away out there to go and perfect, to go and develop, because some of the infrastructures and things, the equipment are not here, so they have to be developed and so on and so forth. So when you have the totality of the work, and then you have the first or the major author as the high income investigator, when you want to search, for example, if you go and Google twinning, there's a particular community in Nigeria, in Western Nigeria, called Igboara, where you have a set of twins in almost every compound you get to. That is where you have the highest number of twin children, twin babies in the world. So if you get there, when you're entering that community, you actually see the display of twins and everything. And this place that is real. Now, if we go on Google and find out who are the people who actually did that, and I found foreign names who have never been to, maybe understood what all of this concept is all about, but they flew in, try to stay with the community, maybe conducted some kind of participant observation or carried out investigation with some LMIC investigators. And at the end of the day, when those things are published, you find the names of those high income investigators. If somebody wants to fund a project or somebody is interested in getting fund out, you go and search names and you find those names there. That's where you are going to be interested, for example, in pumping the taxpayers' money to be able to make sure that, oh, this is a good research, it's good to develop these ideas more, and you're going to be putting money on that. So in terms of visibility, you're going to be seeing that high-income country investigators whose name has been displayed, especially in these days when some styles of writing references make do with just the first name of the author, and the others are just hidden inside a tour. So it takes someone who is painstaking to go and search who are the rest investigators. Otherwise, you just go ahead with that first name that you see and fly with that. And so in terms of visibility, you actually do not see this indigenous, this person who is actually dwelling in that environment, that investigator who has been working and who perhaps does most of the work. In fact, not perhaps, who does a lot out of the work that is being done. So the narrative changes, the landscape changes, the visibility is affected, incongruent, and a lot of things go on when you have a global health expert coming from outside, and then in terms of referring to experts. Let me just say one more point there. If you're talking about expert, who do you refer to as an expert? This is very important. An expert is somebody who has a lot of expertise in an area. This person, for him or her to qualify to be an expert, it means that person is more knowledgeable than other people. It means that person has recognized credentials that you can look at and say, oh, this person is an expert in this area. He can demonstrate that expertise. And not that he can demonstrate alone. There is also a proven track records of activities that this individual has embarked upon in that field of endeavor. So if you have 1, 2, 3, 4 that are taken over by investigators from high-income countries, when are you going to build that track record that qualifies you to be an expert in that area? So there's a lot, at stake when it comes to who is referred to, who is considered a global health expert and who is not, especially with the imbalance between high-income countries and low-income countries, the global north and the global south phenomenon.
Then what happens when people trivialize local knowledge and dismiss the local expertise, especially when it comes to research?
Local knowledge that is otherwise referred to as indigenous knowledge has been internationally recognized and identified as a developing field of inquiry that, honestly speaking, is very important. Its importance cannot be overemphasized. And every investigator knows this. And local knowledge, without it, you can't go far. Without local knowledge, even individuals who have this Eurocentric understanding, they know that you need to get down to that local environment, find out what is going there, at least have a snapshot view of what is going on before you hand over to somebody who's going to continue, and most likely somebody who is in that environment. So it's actually a power transfer. When you have somebody and you throw away something that money cannot buy, you like that issue of twinning that I gave an example of, for example, you have maybe spent all your life in that environment, you have struggled to do so many things, you have lots of knowledge, you have a lot of things, but the system in one way or the other has not given you the opportunity to be able to express yourself. And then you now have somebody, they talk about colonization of different things. This colonization of research is called scientific colonization. So you now have someone who comes and pick that which you have and establish control over you, because you have everything that it takes. You have the data, you have the environment, you have the space, and somebody just comes into that space, into that geographical space, and does engage with you. And this same process of colonization comes into play, brings something in exchange, or to show that, there's claim to bring something, there's an acceptance between you, the settlement is there, the setting is available, and then just go ahead. And at the end of the day, you have lost something that is very important. And so local knowledge is very, very important. And to my understanding, investigators are beginning to understand this as well. So many people are beginning to come to the understanding of the fact that indigenous local knowledge should not be traded for anything. And so you need to negotiate. But a lot of time before 1990 and maybe before 2020, the lot has been exploited concerning local knowledge. Local knowledge is very important. And so we should begin to see how can we develop new analytical methods, new methodologies, new strategies, new things that we can use to project our local knowledge and advance it and bring it to the level that it should be, instead of allowing it to be exploited by anyone, or by higher income countries, or by global north or global south, whatever again you want to call it. Before I forget, let me say the impact of tampering with local knowledge has influence, negative influence, not only on the investigator, because what I've explained now is on this concept of local knowledge as it refers to the individual researcher, but it goes beyond that. The impact is on the researcher. The impact is on upcoming generation of researchers, upcoming investigators, students, impartation of knowledge into next generation. It goes on to the people, the populace, the communities, the people that we are conducting research with, the health system. Because when you're doing research, you are supposed to ensure that you translate that work from whatever research you are doing to clinical practice so that it can benefit patients, it can benefit health system. But where you cannot maximize that opportunity, then that chain is truncated. So both the patient, both the investigator, both students, both the health system, both the community, the populace, everybody, it has a massive impact on everybody if you trade the local knowledge and local information, indigenous knowledge out careless.
So then how can we decolonize research and research training so that communities served are actually positively impacted by the outcomes?
There are 1001 ways by which this can be done, but maybe let me just talk on one of the approaches that could actually be employed to challenge the status quo in a bid to decolonize research and research training for the benefit of local community or indigenous scholars. So there's need for coming together. There's need for looking at methodologies, pedagogies, research findings, dissemination, implementation that will be locally specific to the context of our environment. There is need to look at what is culturally feasible. And this idea, if you go into literature and you see an author, Batiste, in 2005, he actually suggested things that indigenous people can do to engage themselves, to ensure that they are positively impacting the environment with positive outcomes. For example, he gave example of some people, Aborigine people, to allow for space for the Aboriginal consciousness, the language, whatever it is you are doing, you are not lost in terms of your language, in terms of your identity, so that whatever you're doing, you make sure that you preserve those things and you allow them to flourish without any ethnocentric or racist interpretation whatsoever. So they are conscious of that. If everyone in the African continent will carry along that with them, it will go a long way. Apart from that, you need to build capacity. Even though Africa constitutes like 12.5% of the world, another literature says 17%, another literature different figures, but whatever it is, what it's trying to say is that you have a large proportion, coming from African continent, if you look at the total population of the world. But these Africans account for less than 1% of research output. So there is imbalance within this. If you constitute 12.5 or 17% of the world's population and the research output that you are having globally is less than 1%, that's a big problem. For example, if you are going to be able to achieve what we are talking about, we need to produce PhDs. We need to produce, in fact, that author says we need to produce 1 million PhDs. I don't know how we are going to do that when the universities do not have the consciousness and orientation of research. The universities want to educate, want to give information, want to impart knowledge, but there is discordance between that knowledge, that education, and what is going on in the industries, what is going on in the outside world. And they're supposed to be a meeting point. You're not just to produce people, you have to produce people that will meet the needs of the society in other spheres of life. And so there's need to build capacity if we are going to be able to achieve what you're going to talk about. And we need to involve workers at the grassroots level. It's sad to see so many interventions from the high-income countries end with research that stopped abruptly when the fund is exhausted. There is no continuity because the workers, the gatekeepers of the various communities do not have any power or anything to continue. Once the money stops, it ends, and the grassroots workers are not properly integrated and incorporated into the program for sustainability, for it to become well recognized, well owned. And when that money or whatever is over, it can become adaptable to the local context or the local environment so that they can throw their weight behind the project and know how to step it down to other members of the communities and own it themselves. This is not done. So if we really want a situation where we'll be able to challenge the status quo, then we need to build capacity. We need to do all of this that I've just mentioned.
And what mechanisms should we put in place to support African researchers who are doing work in their communities and ensure that they get published and are engaged in solving health challenges as experts?
Again, I will say that Africa makes up 15% of various things that we are seeing in terms of the world's population. From 12.5% to 15% to 17%, though that figure is big if you consider what the total population of the whole world is. Now, Africa contributes 25%, double 12.5. If you are taking 12.5%, double 100% increase. That is 25% of the global disease burden comes from Africa. Yet, it produces between only 1 and 2% of the world research output. How does that balance out? You are 12.5% of the total population. You are contributing the burden of disease, 25%, and the research output that is needed to be able to impart this is 1 to 2%. So you can see the inequalities, you can see the serious implication of how communities are not going to be impacted by the publications, by the things that we are publishing, the things we are bringing out. And the reason for this poor research output, despite carrying 1/4 of the world's disease burden, is multifaceted. You have a lot of things ranging from scarcity of competent, well-trained and skilled researchers that will result in poor supervision of higher degree scholars. So if you don't have enough PhDs, for example, from our universities, you don't have people who can ask questions that can bring a solution. They can ask questions that will make one to start thinking and start looking for what is the solution, empirical findings to profile solution to this. Then where that is not available, the kind of research you'll be conducting will be weak. Because take note, that 1 to 2% of the world's research output does not mean there are no research output. I'm just referring to research output that meets the needs of the hour. Research output that can compete at international level. Research output that is there to impact the society, impact the community, impact the environment. Research output will not be there. If you see the publications that come from high impact journals, take for example the Lancet, the impact factor is 60. You have impact factor of for some journals 10. You have some 5. You have 0.2. You have 0.009. You have all things. Now you find people who are publishing in this high peer review journal that have high impact factor to come from high income countries. So the visibility is there. So it's going to go a long way to affect and influence the work they do. You have the diseases that they are looking after, they are working on to be diseases that affect high income countries and high income environment. And you find names, maybe a lot of names, and you now have the low income countries squashed in between, occupying the middle center, or sometimes even no position if this journal have limit to the number of authors that they can accommodate. So with this, if you are really going to bring about experts who are going to be engaged in solving the problems on the continent, we really need to wake up and do a lot of things. There's inadequate support services. The infrastructure is not there. The facilities are not there for sustainable research. And academics and researchers in Africa work. I've been to some countries where you have people who literally think for you. When there's a grant, they tell you, oh, there's an announcement, there's this ROA, there's this RFA, and then you have a research office, they think about it, they walk it through, and they just call you, okay, what are you thinking about? Then you conceptualize the idea, you design what you have in mind, then they help to develop and bring it back to you, and you look at it. Before you know where you are out to already getting ready to submit, and you are competitive. But in this on our continent where you have to be pluralistic, you have to be multifaceted, you have to be the same person who will go ahead and search for research funding announcements. When you have to sit down and look for how to get people together, how to form a committee, how to start thinking of writing protocol, putting protocol together, how to start competing, it's very limited. So what I'm saying is that without the administrative strength, without the financial capacity, without grants, without public engagement and assistance that the counterparts in high income countries enjoy in some more resource-friendly and resource-rich environment, it may be difficult to really be able to overcome these challenges, especially in Africa. And so the truth is, all of this includes still the legacies of colonialism. And if we are going to decolonize research, which is what I refer to as scientific decolonization, there is need to look for approaches, strategies, interventions that are going to reverse all of this so that we can get to a point where African researchers directly can be empowered. There will be direct empowerment of African-based researchers who can offer quality, who can receive quality training. So you have large number of junior faculty, large number of beginning investigators receive quality training and effective information exchange. When they have all of this, it becomes easy for us to be able to, influence our landscape in Africa. Finally, I wanted to make mention of leadership. Leadership is important. Due to lack of inclusion in areas that are important to us, things that affect us, and how we see ourselves overall. In the course of, listening to other platforms, I heard the concept of being at the table, and that if the table is not going to accommodate us, let us dismantle the table and let's build a fresh table. Why inviting me to the table in the first instance? Let all of us come together, design the table, conceptualize the philosophical underpinning behind the utility of the table, and then sit down and then discuss. That's the concept. That's where the ideology and the paradigm shift. Instead of inviting somebody from low and middle income countries to table where the high income country investigators are already occupying, have already taken the kind of seats they want to use comfortable, and they are seated and they're now inviting you to come and join. So leadership is very important. Can you amplify your voice when your voice is not heard? Can you amplify your voice when you are being represented in an authority that is called minority, and you don't even have a voice? Even when you are there, what you say does not come to public display. It does not come out. It can be removed or can be brushed aside. So there is need for inclusion in the issue of leadership in nursing workforce, for example. Very important. In nursing national, international boards, in nursing association, leadership is key if we are going to have inclusion of nursing workforce in all of these now. And if you do this, it will help us as African investigators, African researchers to be able to engage in solving health challenges as experts that are domiciled in Africa on the continent, identify with the problem on the continent, proffer on the African specific solution to those problems.
Thank you, Dr. Prisca. So at the beginning of the pandemic, there were discussions about how Africans are unprepared to respond to COVID and speculations on the devastating toll it will take it will have across the continent. However, we've actually seen that cases where the handling of the pandemic has been better than that of the countries in the West. So how can we document how African countries have handled this pandemic and share our learnings with the world?
I must tell you that a lot has not been documented. Honestly, there's a lot going on. WHO rolled out a lot of information when the pandemic came out. African nurses were just there doing lots and lots and lots of things. When it started, it was like, you're going to be picking dead bodies on the street. And by the time the waves begin, Africa is going to be empty and all of that. We had kind of things, but it didn't play out that way. Now, what is responsible for all of this? There are so many things. Africa is a blessed continent, honestly. It's a blessed continent. If you find yourself, one day I was in one of these countries where slavery of Africans in yesteryear's slavery was high, and I was just shedding tears. That do you mean My great ancestors in Africa with hands, because there was no technology, there were no tractors, there were no this to build this type of tunnel, very solid and very far. We were still working in it for a long time. And I was just imagining what kind of human beings are these, what kind of energy, what kind of things do they have to be able to do all of this that now is still being used and it remains solid and wonderful as it was. But the kind of emotion it brought to me was different from the people who were taking us, sightseeing and seeing things. I was weeping inside. I'm saying that for as Africa, we are honestly speaking, very blessed. And the point I'm making is, when this happened and it didn't go that way, it's a high time we began to think, what did we do differently? If as an African, for example, in my country, Nigeria, if you throw a piece of corn on the ground, you don't need anything. The next time you go there, you see it germinating. But it's not like that for somebody from high country where the environment is not conducive for that kind of a thing. So they need to think and imagine what exactly are they going to do to modulate the environment to make sure that it is conducive to be able to do this kind of a thing that they want to do. Now, unlike me, who is in an environment where I can just decide to throw that in there and it's going to grow. I don't have to, I may not be spoiled to want to think of what to do. If I'm going on anywhere, I can go and lie down under the bridge and just sleep. I'm fine and wake up. If I try that somewhere else, I'm going to freeze to death. So because of that comfort, in quotes, or how nature has made it that things just by providence just go out that way. So I'm talking about COVID. With COVID, Africa woke up. Africa just woke up to some things. You find the different African countries moving from Egypt, from Cairo, from all over Africa, Tanzania, from Rwanda, from every Malawi, like everywhere, everybody just woke up and began to do something. You find different people in different countries quickly adapting to the situation and coming up with different things. A lot of things came up. Some people developed, Ghana, we had that robot that came up from Ghana that they used to be able to attend to patients. Things that were not there before. People began to think and say, what can we do to respond to this? All universities closed at the same time. And then we are talking about physical distancing or social distancing, which those things we can do it for a short time. But when our pockets refuse to be locked down, we cannot. We just have to get up and begin to think of what else to do. Now, I'm saying that the high-income countries approached it in a different way. We approached it initially following how they were approaching it. And then when we saw that that's not going to work for us, nobody taught us. Everybody adapted and began to do things. But in the course of this, there are stories. So the question is, how much of those stories have been documented? What I'm saying is that we need to document this story. We need to find out what is it that happened in environment, all of this situation that I've talked about. Some countries, I think it's Rwanda, actually went very fastly. They went electronic and they subsidized it very much. They removed all the amount of payments that are on this so that people do not have to do physical face-to-face kind of transactions, and you just go online and do whatever you want to do. And all of those things before COVID, you will have been thinking, oh, that's not going to be possible. People began to attend burial, over Zoom. You will have said, no, God forbid, how will I bury my own father without all the things that accompany it, with Ashwebi, with things that I need to buy it for people to know that, oh, my mother or my father was given a befitting burial. Suddenly, nobody taught us. That's why COVID has actually been referred to as a game changer. It's the best teacher of the year 2020. It came and it taught everybody lessons, and everybody woke up and began to think differently. And that is one interesting thing for me that Africa did. A lot of things in all African countries, as a continent, people got up. Nigeria was one of the countries that first of all come up with the sequencing the SARS-CoV genome. In Nigeria, it's fantastic that you are not thinking of anything like that yesterday, before COVID, but now COVID here brought a challenge and everybody rose to it. So can we rise up to everything like this? Can we begin to respond to politics, to leadership, to administration, to governance, to restructuring, to every other thing, the way we've responded to COVID? Even countries where they do not have a tendency to believe in all of this, they went on Madagascar product And WHO assisted in making sure they do the clinical trial to ensure it is safe. So everybody on the African continent was on the move, doing one thing, either coming up with a robot that even the US, after using Africa continent as a pilot, began to use also in the US. So different kind of things propped up on Africa. But the point I'm saying is documentation, share the story, make noise with it, and let it go viral everywhere that this is what is happening on the African continent. This is what we have done differently. This is the result that it has produced, and everybody will be happy for it.
How can we change the perception of our knowledge systems and encourage more reliance on them in addressing health issues that we grapple with?
COVID is an example. Giving these success stories and looking back to what exactly did we do right that produced result. If you are doing something the same way several years and it's giving you the same result, you need to think and change your method. Something needs to be changed. You don't continue to do it and expect a different result. So you need to go back to the drawing board, ask questions. What are we doing right? That is what research is all about. Finding solution to problems, providing answer to questions. Ability to recognize questions from whatever you are doing is very important. And when you want to find solution to that question or solution to that problem, you're actually researching. Researching in its simplest form is searching and searching again. Research. You search, and you search until you are up with a solution to the problem or answer to the question. So if you really want to be able to get to that point of knowledge transfer, you have to be able to ask yourself, what do I need to do differently? And then to be able to get a different result from what I've been getting all along. That would be a very important point to consider. And strong willingness is important to adopt new things. People are a little bit skeptical when it comes to change. And the only thing that does not change is change itself. See how every one of us, we started working from home. It's a concept that we are not used to. It's a new normal. You working from home, it's like you're not doing anything. But now, you know how to work from home. You see deliver. If you don't deliver, you are not competitive, you will be yanked off whatever you are doing. So you have to be. So it's not that you put on your system and you are there doing something else. Initially, some people, when you're on Zoom on the African continent, you see them doing something else and everybody became conscious and adapted. So we are all adapted. So I know, okay, I want to have a Zoom call. I want to go to meeting. I want to have Google Meet. And I need to comport myself to the virtual world. That is kind of change that has happened. I'm just giving that as an example. So we really need to bring a knowledge base to ask ourselves, what do we need to do differently? I know it's too early because of COVID to assess what we are doing in terms of knowledge impartation with electronic recording, electronic format of teaching, which generally speaking, we have not been used to, we have not been doing. Now we've started, whether those learners are learning, whether learning is taking place, because learning will not take place until there's a permanent change in behavior. Whether learning has taken place, whatever is going on, it's too early to begin to do an evaluation. We will all see, but at least there's a paradigm shift. Everybody, students, teachers, learners, patients, nurses, people are more conscious of electronic modes of doing things, and they are more conscious of virtual space. And that is one way that knowledge can, be exploited. You can expand knowledge using electronic format. I learned about electronic format of electronic records of classification of nursing system, for example, at the University of Iowa in 2005. And when I came back, I was like, oh, boiling. Everybody, we are going to do electronic health records. But it was like a fire extinguisher just came and put it off, because it's not by mouth that you want to translate from paper-based health system to electronic health system. A lot of modalities have to be put in place. A lot of activities have to be embarked upon, interventions, the digital world, the kind of electricity, the network facilities, and so on and so forth have to be put in place. And when those things are not there, well, I just kept my mouth shut. So we go ahead with paper and we interface sometimes. But now with COVID, everybody knows that, look, we just have to go electronic. It's going to make life easier for us. So in terms of knowledge, everybody is learning. In fact, I never knew it's possible to teach practical orientation things on online. But now we are all there. You are teaching practical. You are teaching clinical placement issues. You are teaching them using YouTube, using videos, using all of those things. Wonderful. That's where we have found ourselves. So there are paradigm shifts that are going on in knowledge, in education as a result of COVID, that everybody has no option than to just buy in.
Dr. Prisca, you are an active member of the African Forum for Research and Education in Health. How do institutions like AfriHealth influence research on the continent and support African researchers?
This is a wonderful question. And I'm glad you're asking it because I'm on this platform riding on the wings of AfriHealth. I believe you know that. Is the CUGH AfriHealth satellite that brought us into contact and that's given me the opportunity to be able to share this. AfriHealth is an African forum for research and education in health. That is the meaning of the acronym AfriHealth. And it is an interdisciplinary health professions organization that works with different ministries of health in various countries on the continent, various institutions, various stakeholders and individuals and corporate entities to improve the quality of healthcare in Africa through three important things. And that's where your question becomes important. The first is research, the second is education, and the last is capacity building. In terms of research, everything from the title, from the theme, from the meaning, from the philosophical underpinning, from the transformation of AfriHealth from the days of MEPI, Medical Education Initiative, to Nursing Education Initiative, from that time up to the present day, in the fabrics of AfriHealth is research. As a matter of fact, there's a 4 million grants from NIH that is still on till date. And research is a heartbeat, not only for just AfriHealth, but for anyone who is interested, in becoming a member. If you visit the website of AfriHealth, you will see a lot of things. For example, I just visited there before, coming on here. And some of the things I found there are very interesting to me because they really strike the chord of research. For example, the vision of AfriHealth talks about being a responsive and leading African forum in the pursuit of excellence in health research. So if you want to pursue excellence in health research, there's no how. If that is your vision, there's no how your activities will not have research. And that takes me to the mission. The mission of AfriHealth is to provide African leadership for responsive health professions, education, training, research again, and service delivery. And so if you see an organization that has research embedded in its nomenclature, research embedded in the title, research embedded in its vision, research embedded in its mission, and the various activities. If you look at benefits to anybody who is a member of AfriHealth, for example, you are given a platform to grow professionally because you come across different arrays of interprofessional researchers that you can network with, you can collaborate with. I have had that privilege. And if you go to the website, you see testimonies of different members who have benefited and who have had the opportunity of staying on the shoulder of giants to see afar off because AfriHealth provided that platform for them to grow professionally. It also gives the opportunity to participate as a researcher, either as an implementer in a grant or as a researcher in actual intervention that is going on in a particular grant. There are so many opportunities that AfriHealth supports. It gives you opportunity to collaborate with seasoned multidisciplinary mentors from different parts of Africa in the continent and gives access to valuable education, to research, to service. If you go to our website and you see networking going on, if you read the newsletter, we have newsletter that comes out quarterly. That newsletter gives you opportunity. It makes you to let your voice be heard wherever you are on the continent. There are research activities going on. We just concluded several, where we are trying to find out what African continent health profession students within the AfriHealth network, what is their own understanding, their attitude, their preparedness, and their knowledge about COVID-19. And it's amazing. We have 16 African countries. Students from 15 African countries participated in that study. So it gives you an opportunity to express your research acumen, your research appetite. There's a flaw. There's even the opportunity to gain access to funding opportunities. Some individuals who are members have been given opportunity to participate, to carry out research with small grants, some little amount of money that you can use, like seed grants, that can assist you to actually be able to conduct some studies which you wouldn't have been able to do by yourself. And not only that, you give access to be able to connect with funders. You have opportunity to connect with funders if you're a member of AfriHealth. So you gain access to funding opportunities. You connect with experienced, renowned academics, institutional leaders, expand your base in terms of relationship with other people who are conducting research. You collaborate with them and you contribute to AfriHealth community of practice and becoming a part of AfriHealth's continental-wide constituents of advocacy and everything you want to do in the area of research, either as an individual or as a corporate entity. In fact, in the activities, you have webinars that goes on concerning different wonderful areas, topics, things, especially on COVID that has gone on, online workshops via learning management system, annual general meeting where people are allowed to bring their various information from their various environment and rub minds together, an annual symposium. And that annual symposium is a big symposium that holds, and you have student exchanges, you have grant writing workshops, you have opportunities for participants to meet with funders and what their interest areas are and how they should develop their protocol and how they should go about, linking them with people who can assist them. And that symposium is a big one, for every member of AfriHealth. And everyone, every nurse, every doctor, every physiotherapist, everyone who is health profession is encouraged to be a member. Fantastic and unique nature of AfriHealth is the interdisciplinary. Is about the only organization that brings these different arrays of all health professions together, and you have them, learning together. In fact, there's a new AfriHealth sponsored program called genomics, which used to be that students of health professions go on bilateral exchange program within the African continent. And now we want them to be able to go as a group, as a team. So if you are going to apply as a nursing student, a medical student, a physiotherapy student, a pharmacy student. Wonderful, yeah. So that if you don't learn together as students, if you don't engage in community activities together as students, if you don't conduct research together as students, if you don't develop protocols together as students, it becomes difficult when you are all suddenly lumped together to be working in an environment and you want to be seen in one direction, be able to collaborate and work amicably. So those kind of things are what AfriHealth, and lots more that time will not permit me to talk about, which gives opportunity to be able to develop your research muscle, be able to network with others, be able to collaborate and actually practice in terms of gaining access to seed fund to carry out your own study. So AfriHealth is doing a lot. It's a fantastic organization, and I encourage everyone who is in the health profession to please go to the website, sign up, become a member, and join.
What does equity in global health look like to you, and what investment should we prioritize to make it happen?
Equity is absence of avoidable or remediable differences among groups. When you have groups or you have people or you have a set, you want to make sure that as much as possible, avoidable and remediable differences are not given room to thrive. You want to ensure that there is absence of anything that will bring differences. Equity is bringing everyone on the same platform, socially, economically, demographically, geographically, and in a nutshell, avoiding inequities. Anything that want to bring inequities, you must avoid it. Inequities with respect to health determinants, access to resources, being able to maintain and sustain and generate and come out with positive health outcomes. Anything that is going to bring about inequity in that area is avoided, is not given opportunity to thrive, and there's no room for it as much as possible. Now, how do you reduce inequities? And why is it important? It is important because health is a fundamental human right for everybody. It is your right. It is not a privilege in any way. And it's progressive, the progressive realization of removal, of avoidance of inequities at all forms is what will enable us to know that the differences in health status can be taken care of. And it will transit and dovetail into diseases, into disability, into opportunities that everybody has to enjoy life and pursue one's life goals, life plans, and so on and so forth. So when you're talking about equity, it's a very big thing, but in a nutshell, that's just the way I can explain it. And a characteristic common group that experience health inequities are marginalized people, the poor. There are forms of racial, ethnic, women lack social, political, economic power, and so on and so forth. And if you educate a woman, you have educated a generation. If you educate a woman, You have educated, lots more of people than, in fact, a whole nation has been liberated, has been empowered. So the inequity between male, female, between economic power, between racial, ethnic, and all those groups, avoiding it completely, ensure that there is an equal platform, so to speak, that equal distribution, and everyone has access to all of those things that are needed to be determinants of positive outcomes of health, and in doubts, any doubt of enjoying life to the maximum and enjoying the plans that you have and your goals that you have for yourself as much as possible.
It's been such a fantastic conversation with you, Dr. Prisca. I've thoroughly enjoyed myself hearing your thoughts and getting this exposure on research. And I'm sure our listening community would really enjoy listening to this. So thank you very much for your time.
Thank you so, so much. I didn't know we have come to the end. I'm beginning to enjoy it so much, and I am falling in love with it. And I want to thank you for your beautiful manner and approach and the professionalism displayed in asking these questions. Thank you so much.
Thank you too, Dr. Prisca. I have really enjoyed speaking with Dr. Prisca and learning about the research space on the continent. My biggest takeaway is that we need to create the infrastructure for research, and this has various moving parts and calls for resources and support from universities, where universities structure themselves for PhDs so that research can be done properly, and governments, where they see the research that comes out of universities as important and so they fund it. Finally, we also need support from research funders and the systems that make it easy for this important aspect of global health to thrive on the continent.